A very good morning to the distinguished guests and participants. Sustainable Development Goal 4 poses with the need to significant increase in the use of data to guide system-level improvement for education outcomes in learning and for equity. Proper management, analysis, and use of educational data is critical for improving learning outcomes and monitoring progress towards attainment of lifelong learning for all. For close to 30 years, DHIS2, an open-source data management platform, has contributed to improving availability and use of health data in over 80 low, middle-income countries. With its flexibility, comprehensive tools, and functionalities, DHIS2 offers an opportunity for educational managers and policymakers to leverage its use to improve education data management, track and monitor learning progress, identify areas for improvement, and ultimately drive positive change in the education sector. DHIS2 for Education program has, for the past 2 years, held a conference and academy, bringing together educational stakeholders, experts and practitioners, and policymakers from various countries. The event has provided a unique platform to share experiences and engage in discussions on how the DHIS2 platform that has been used in the health sector for over 30 years can be leveraged for effective education, data management, and track and monitor learning progress, support data integration, visualization, and use, and ultimately driving positive change in the education sector. Since 2021, DHIS2 for Education has been implemented in Sri Lanka with the support of HISP Sri Lanka, the Ministry of Education's independence to drive and customize the system based on their needs has been commendable, and in unique ways of using system has been a major motivator to other EMIS units across the project. With that great intention in mind, we warmly welcome you all to the DHIS2 for Education and Conference 2024. This preparation is to light the oil lamp according to the traditions, symbolizing the radiance that illuminates our path ahead. For this, I'd like to cordially invite Dr. K.P. Munagama, Additional Secretary, Ministry of Education, Professor Wajira Disanayaka, Dean, Faculty of Medicine, University of Colombo, Dr. Palitha Karunapema, Director Health, Information, Ministry of Health, Ms. Manomi Senviratna, Principal, Visakha Vidyalaya, Ms. Mohini Viktesh from Save the Children, Dr. Kenneth Starring from University of Oslo, Ms. Sofia Kozakis from University of Oslo, Ms. Pamod Amarkon from HISP Sri Lanka, Mr. Alfredo Muchanga from HIS Mozambique, Ms. Monica Ahuma from HIS Uganda, Mr. Jerry Oziaba from HISP West and Central Africa, Mr. C.D. Ahmed Jallo from Ministry of Education, The Gambia, Mr. Khalifa Faye from Ministry of Education, The Gambia, Ms. Nelly Dlamini from Ministry of Education, Eswatini, Mr. Peter Nikambole from Ministry of Education, Eswatini, Ms. Priyanti Kodituaku, Central Provincial Education Department, Ms. Buddhini Gavaramana, representing KIX EMAP National Steering Community, Ms. Prabhat Aryaratna, Welfare Benefits, Board, Ministry of Finance. Thank you, everyone. Ladies and gentlemen, to honor our nation together, please rise for the national anthem of Sri Lanka.
Sundara Siri Varini බැවිනා යමු යමු වීනොපමා ප්‍රේම වඩා සැප වේදතු ගරදා නමෝ නමෝ මාතා අප ශ්‍රී ලංකා නමෝ 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 මාතා අප ශ්‍රී ලංකා නමෝ 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 මාතා.
Thank you, everyone. I now cordially invite Ms. Dakshina Kasthuriarachchi, Director of Education, Data Management Branch and Information System Development Unit, Ministry of Education, to deliver the welcome speech.
Good morning, ladies and gentlemen, esteemed guests from all around the world and from Sri Lanka, and my dear colleagues. It is with immense pleasure and profound gratitude I extend my warm welcome to each and every one of you for the DHIS2 for Education third conference and academy in Sri Lanka. And it is with great pride that I welcome distinguished guests from University of Oslo, his center, Dr. Kenneth, Dr. Kitty, Mrs. Sophia, and Mrs. Alice to Sri Lanka. And again, I warmly welcome his network distinguished guest from Western and Central Africa, his Mozambique, his Uganda. Yeah, warmly welcome you, and your presence here is gracing the occasion. And then I have the privilege of welcoming esteemed, with honor and pride, I warmly welcome Professor Wajira Disanayaka, the Dean, Faculty of Medicine, University of Colombo, and Dr. Palitha Karunapema, Director Health Information, Ministry of Health, and Dr. Munagama, Additional Secretary, IT and Digital Education, Ministry of Education. The presence of you all here is very graceful and beautify the occasion. And I'm deeply honored to welcome Dr. Pramod from his Sri Lanka and his team. Dr. Pramod is the driving force behind all these happenings. And as well, I'm deeply honored to welcome principals from Sri Lankan School, Vishaka College and DS College, and provincial zonal coordinators and colleagues from Ministry of Education, and Save the Children participants from India. Even though World Food Programme participants and Save the Children from Sri Lanka is not present here, we should gratefully remind them for this occasion, for the contribution that they made to make this a success. And last but not least, there's a single person who made all these changes. I think if I don't mention this name, I'm very unfair. He's Mr. Prabhat Aryaratna, former Assistant Director of the Data Management Branch. I should take 1 or 2 minutes to explain the behind story of all these happenings. Dr. Pramod from his Sri Lanka was in lecturer at master's degree program where Mr. Prabhat was a student, and he was explaining how DHIS2 is used in the health sector to collect, aggregate data and to develop systems. So in the coffee break, Mr. Prabhatariyaratne has gone and asked whether this can be utilized in the sector of education also. So that coffee break discussion made all these changes. So I extremely grateful to his Sri Lanka for the efforts they have taken to train the Ministry of Education staff to customize DHIS to software according to our needs. Dr. Pramod and his team came and taught us how DHIS2 can be customized. Not that we are asking to develop the system from the Oslo University, but they taught us how to customize the DHIS2 software according to the needs of the education. So that made this change, and there's a significance also of this DHIS2 for education logo. This was temporarily made by the Sri Lankan team to, before night, they come to the training of the Ministry of Education, and then that logo made standardized for the DHIS2 for education logo as the standard logo. So once again, let me welcome you all with open minds and open hearts. We are waiting for the days ahead activities, and let all the festives begin. Thank you so much.
Thank you so much, Madam. DHIS2 has been well established in the health sector of Sri Lanka for over a decade. In our implementation of DHIS2 for education in Sri Lanka, we have been closely following the learnings from the health sector. Let me now call upon Dr. Palitha Karunapema, Director Health Information from Ministry of Health, to deliver a speech representing the Ministry of Health.
Aibowan, good morning to all of you. Mr. Munagama, Additional Secretary, Professor Wajira Disanayaka, Dean, Faculty of Medicine, University of Colombo, all the delegates from University of Oslo, his network, Dr. Pramod from Sri Lanka, all the education directors, principals, all the national and international colleagues. I mean, indeed, greatly appreciate his Sri Lanka invitation to participate in this important workshop. It's indeed a pleasure to face this international audience. As some introductory remarks, I heard that all started in a coffee break. I suppose that's very much true in many occasions. Even in a main conferences, coffee breaks are more important than sometimes the main event. So I think that should follow. I try to give some insight what has happened in health sector, in digital transformation in health sector over last 10-15 years. Professor Wajira also here, so he's a kind of a legend in this area and incorporating this health information into the medical stream. And around 2010-2012, gradually we were transforming manual information system in the health sector to digital information system. So basically to improve the data quality, data use, and this information by digitalizing the health information system, we want to make sure that the decisions we are taking based on this correct information in right time. So initially it was a difficult journey, and there were some ad hoc interventions and improvements in the information systems. Again, DHS2 also one such application. So we endorsed that around, I suppose, in 2014-15. Then in the health sector, many national programs like Family Health Bureau, Epidemiology Unit, now using DHS2 for their routine information, as a routine information system now. It mainly captures the aggregated data, but during COVID-19 we have seen its capability of capturing individual data and making a difference in Sri Lanka, and not only in Sri Lanka, in many other countries. In any ministry, this transformation is very gradual. You can't do it overnight. Even though, there are many softwares available, software is only part of the solution. There must be infrastructure. To run this information system, you need adequate human resources. Then there should be guidelines and so on. Security aspect, there are so many things. When you are going to run an information system, that need to put into place. So I was just talking to Mr. Monagama. In the ministries, we face tremendous challenges in every sphere, from funding to human resource to IT infrastructure. So it is really important that we need to talk about softwares, especially open source softwares are very important for us. Open digital health platforms are like DHS2, Open MRS. In health sector we are using currently, so those are very important. But at the same time, we need to focus on other aspect also to implement these systems. Then around 2021, ministers realized now we have a lot of information system, data integration and interoperability is an issue. So at that time we started developing digital health architecture blueprint. Our health informaticians, ICTA and global experts, we get together and develop a digital health architecture blueprint for Ministry of Health. I think this is one of the key developments recently. So that pave a way for many information system come into a kind of a larger picture. So that will future development of information system. So now we have in 2023 we published, and now all our work, all our investment and human resource development, many things driven by this digital health architecture blueprint. So in one of the key principles there is to use the open source digital public health goods. So that is where DHS2, OpenMRS like softwares are coming into place. I suppose health education sector also could learn a lot of things from health sector, and we are also eager to share many data with education sector as well. We know that medical school inspection, health promotive schools, nutrition, all are cross-cutting with the education sector. We are still reluctant to share data. Forget about the ministries, even within the ministries, we are reluctant between units. So we need to foster this open data sharing as well. So those are the things we need to discuss. I suppose during this conference, you will deliberate on many things and come up with many important recommendations for the education sector. I sincerely hope that education sector will succeed, because it's the sector where you produce even the IT skills, IT human resource. With that, I will conclude my speech. Thank you very much.
Thank you, dear sir. DHIS2 was introduced to Sri Lanka in the year 2009, closely following the establishment of the Master's Program in Biomedical Informatics to invite the pioneer of establishing the postgraduate studies in health informatics at University of Colombo, Sri Lanka, presently the Dean of Faculty of Medicine, University of Colombo, Professor Wajira Disanayaka, to address the gathering.
Good morning, everyone. Thank you for those kind words of introduction. Additional Secretary of the Ministry, other officials of the Ministry, the principals, my colleagues from University of Oslo, my colleagues from DHIS to Sri Lanka, everyone who have come here from the DHIS2 network from abroad, other distinguished invitees, delegates, ladies and gentlemen. It gives me a great pleasure to say a few words at what must be one of the most unique events in the development of digital services in our country, because I gather this is the first time that an event like this with DHIS2 in education is being organized. So I'd like to congratulate HISP Sri Lanka and the HISP network for embarking on this journey. My mind goes back to actually 1998 when we in the Sri Lanka Medical Association started talking about, how do we integrate informatics at that time, medical informatics, that what it was called, to the health sector. And you can imagine, with the technology at that time, that was like in the dark ages. But we embarked on it. Devices were not widespread available. There were no trained people, and so on. Time lapsed from that time. I was just soon after passed out medical graduate, just going into the field of medicine. Then I also went away to do various things. And then in 2008, suddenly one day I got an email from a colleague at University of Oslo, Sandeep Sahe. Sandeep, I've never met him. I've been told that somebody called Wajira Disanayaka in Sri Lanka is interested in health informatics. And so he just contacted me. And he said, we'd like to work with you to introduce public health informatics to Asia. I told him that public health in Sri Lanka was very firmly established. And if I were to go and meddle around with public health, I will have serious issues. And Palitha is smiling. He knows the difficulties that I would have had if I were to do that. So I articulated a kind of a vision where I said that we want to embark on developing leaders in, by that time, the word e-health has been coined. So leaders in e-health who could work closely with the policymakers, meaning the ministers and of course the administrators at the highest level to digitalize our health systems. So introduce e-health. So with that vision, we started a master's program in biomedical informatics in Sri Lanka. And to cap that, a MD program in health informatics. So you go and do a master's, and then you do a MD. And once you do the MD, you end up being a consultant in health informatics on par with any other consultant in the medical field. So like a consultant surgeon, a consultant physician, a consultant neurologist, anyone you want to call it. This was a unique program in the world because it's only in USA, the other country, where a medical doctor can go and become what we call a board certified consultant in health informatics. In USA, they call it clinical informatics. In Sri Lanka, we call it health informatics. So we are the second country in the world to do that. So we are in a unique position because we have produced more than 300 master's graduates. And of them, about 75 of them have gone on to do MDs. And they are working not only in Sri Lanka, but all over the world for the WHO, in various regions, for the CDC in Atlanta, and all kinds of other places now doing consultancies and so on. So that's a unique workforce that we were able to create for the world. Now, when we started that work, there was nothing. 2008, Ministry of Health, there were discrete health systems which were developed by IT people. And when we did a survey, the majority of those systems have failed. There was no link with the IT people and the health people, and the design sometimes did not fit purpose, and then after a while the systems failed. So we had a unique opportunity to innovate, and that is what we did. We embarked on what we call frugal innovation. What do you mean by frugal innovation? Low cost, highly effective solutions that were tailor-made to meet the needs of the Ministry of Health, and they were developed on open platforms, meeting open standards, and eventually they were Ministry of Health owned and maintained. So with that, we were able to develop systems that were scalable. So for example, one of the systems that we developed, we meaning our graduates and our staff, together with the Ministry of Health administrators and others, was a system called EMIS, the Electronic Reproductive Health Information System. That system is now, it was developed on the DHIS2 platform, scaled up to the entire country within a period of 6 months. And it today captures all the maternal data, maternal health data, and the school data of the country. I've been told at any given time there are more than 4 million children being followed up on that system, and more than 500,000 pregnant women. And this system was innovated on DHIS2 platform. And because it's an open source platform, no cost for that. And because we had trained our master's graduates on DHIS2, there was no cost on software development too, because our graduates who are working for the Ministry of Health as health informaticians after graduation, that was their part of their work. So this is a unique story, story built on DHIS2 that we were able to scale up. Then, going further, not only can we have local impact, but we can have global impact. In 2016, the president at that time, around 2013, I think 2013, 2014, was interested in tackling the matter of malnutrition, and we were called in to help develop a system. So I was called in and said, okay, can you develop a system to monitor children? Pramod was my student at that time, and I told him, Pramod, you have a MSc project. So we immediately embarked on that project, innovated, developed a system, which eventually was capable of monitoring every child in the community, and we used GIS mapping, which enabled us to even pinpoint where the location of a malnourished child was down a particular road to that point. It was scaled up to about 4 districts, but then eventually now it's getting, I think, integrated to the EMIS system. But that system in 2016 was recognized as the best innovation in digital space from submissions, hundreds of submissions that were made from 78 countries to the World Summit Award, which is the highest recognition for digital innovation in the world. And so Pramod and the team that was involved in that got that award. So we have the capability in this country to reach those dizzy heights. And we have the capability in the countries which are represented here as well, from the HISP network, to reach those dizzy heights. But we need to take those pioneering steps. We have to take those steps. We must not be pulled down by all the negativity that goes around the world in social media. None of us are second to anyone. All of us, whichever country which we come from, have a world-beating story to tell, and we can pioneer. My last story on DHIS2 is the story of COVID. In 2020, when COVID broke, a few months before that actually, so COVID, people started becoming available on, becoming aware of COVID around February of 2020. But things started breaking, the news around 2019 December, and Achala and Roshan and a few others walked into my office and says, there's going to be a global pandemic, and we have a system which we can customize to monitor or customize for surveillance. And that's what they embarked on. And I can distinctly remember February or March when we went to the lockdown. All of us were in this room down Bagatale Road, in a company that you may know in Sri Lanka called WOS2, which is one of the world's top companies which does innovation on open source platforms. And we were all huddled into one room, and they were doing the work. I just walked in there. There was like nobody on the roads. As doctors, we are a little privileged because we have that doctor's badge, and you can get out on the car and go anywhere, and nobody would stop us. And we all went to that room, and they were doing the work. And a few weeks down the line, they had customized the system. And that was rolled out, and eventually rolled out in more than 50 countries. And I can distinctly remember in 2020, the Norwegian Prime Minister went to the UN and said, DHIS2 customized in Sri Lanka has been rolled out in all these countries. So these are, stories that we can be proud of. And I related these stories because amongst you from Commonwealth countries, I use that word Commonwealth countries because I work with Commonwealth countries a lot. So I see some of you here from Uganda, Malawi, and others. And then, of course, our own country, Sri Lanka. We can pioneer, and we can, in another 5-10 years down the line, have stories like this coming from the education sector as well. And that's what we should aim for. All of you in this room are a champion, and you can champion innovation in your workplace. You are the person who knows what innovation has to happen. And the innovations that have been brought on in the field of health in Sri Lanka has been made possible by our graduates as well as others who saw a problem, and in that problem, not a challenge that they can't overcome, but an opportunity to innovate and overcome that challenge, as well as overcome create value for everyone. So that is the message that I have for you. We can all, I hope, in another 10 years' time, look back at the innovations that are happening in the education sector and take these things forward. And I, of course, am a part of the education sector because, I'm not a Ministry of Health person. I'm a Ministry of Education person, being a university academic. And I'll be happy to, assist the Ministry of Education in whatever way we can. And I've had many interactions with the Honorable Minister on various initiatives that I do, not only on digital, but also in genetics, genomics, and other things. So I'm sure we can have an opportunity to really take these things forward and take them to DC heights. So with those words, let me thank the organizing committee for having invited me today to talk to you. And I hope that you will go from strength to strength. And I can assure you that the support of our entire team in the University of Colombo is with you. And I'll be happy to extend that support to all of you together with the DHIS2 network colleagues who are here. Thank you very much.
Thank you, sir, for your valuable insights. We are honored to extend a warm invitation to Dr. K.P. Munagama, Additional Secretary to the Ministry of Education, Information and Technology, and Digital Education, Ministry of Education, to address the distinguished gathering. Your expertise and insights would greatly enrich our event, and we look forward to your valuable insights.
Good morning, all distinguished guests representing the HISP community. I think it's a community now because it's going around the world, doing a lot of things for the betterment of the world. So it's happy to join with you in this morning. It's a pleasure. So first of all, I would like to present my thanks to giving me an opportunity to address you in this morning. So as the Ministry of Education, we are using DHIS2 for certain instances because especially for the teacher data. Nowadays, we are saying that data is the money. And this, as a second step of it, digital approach, something different and something, some sort of advancement of the data. So in these both scenarios, data is very important, and on the other hand, it's very doing a crucial thing because of now, as you heard from the morning speeches, the most wanted areas of the society is addressed by DHIS2 data platforms, education and health. So that is the future of the world. So I'm so happy to say we are as a partner of DHIS2 community and his community. So we gained a lot of things from it because I think so some of our Sri Lankan participants already known about that Ministry of Education faced in several COPA meetings at the Parliament. We lost our dignity, especially by the data sector, because of losing the national education information system platforms. However, we survived on the other hand with the assistance of DHIS2. I have to say that. So likewise, lot of things are coming and going, but I want to draw your attention for another two things. That is, one is the security of data, because now especially education and health is the most biggest data pool in the country, any country. So if some sort of leakage is happening, that won't be an easy thing to that country. So we have to assure that kind of things. Then the second thing is the validity and reliability, because as our countries, as same as the things are coming with the African countries, I think so, because reachability is one of the difficulty, proximity to systems. So the delay in data update is a big problem. Nowadays, Sri Lankan Education Ministry also suffering from the same thing, because we have the platform, we have the people, but the update is happening very slowly. So whenever it is possible, please aware the community the importance of updating the data, unless it is useless. We can develop all the software, infrastructure, hardware, and all the material, train people, but if the updating is slow, so nothing will happen in the system, because health and education is the most critical area in policy designing matters. So as our professor and our director said, DHIS2 is doing not having a high public attention, but doing good things. it's happy to hear that. And our team, including Dakshina and our other team, and I'm happy to hear that Prabhat is the initiator, because he, during that career in Ministry of Education with us. So, however, so day by day it's advancing and performance are gaining more and more. So I wish all the success to implementers, introducers, and doing something for the betterment of the society with the assistance of DHIS2, and especially the foreign delegation, professionals from and academics from University of Oslo and University of Colombo, and other distinguished professionals from the HISP community representing all other countries globally. So I think you will have a wonderful 2 days from today to tomorrow. So we expect more and more development in this data sector with the assistance of DHIS2. So I'm not taking much more time of you. Thank you so much for giving me an opportunity to address you. So wish you all the success in these 2 days, and for the whole international community to have something different and something fruitful to society with the assistance of DHIS2. Thank you.
Thank you very much, sir. We're delighted to extend a warm invitation to the dancing troupe of Disanayaka College to grace our event with a traditional dancing item. Your talent and cultural representation would undoubtedly enhance the richness of our gathering.
taka tum 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 kada kada taka nang kada kada taka tati tati bakatita
වීර ශෝකය රුදුරු සිතිවිලි මිනිස් භාවය විදාලු අරුත්ගෙන දෙයි නර්තනය තුළ මිනිස් සිතුවිලි පසන්ලු තානෙනාතම් තානතනතම් දානෙනා කසිරටේ සිටනා ගුරු උන්දා උසිකටුවගෙන සැටමසාන්දා ලවසිලවන මුහුරා කරගන්දා කසිරටේ ගුරු උරුණු කියාන්දා
kati 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 kuda
Thank you very much for the cultural representation. We are honored to have Ms. Buddhini Gavramana, representative for the KIX EMAP National Steering Committee, to share her insights with us.
Good morning, all. First of all, distinguished guests, ladies and gentlemen. First of all, I would like to thank the organizing team for giving this opportunity to me today. As the Deputy Director, Policy Planning, Minister of Education, and a member of the National Steering Committee for GP Cakes, I will be representing today the Director of Education, Policy and Planning, Minister of Education, and the focal point for Global Partnership for Education, Mrs. Jaini Prishangika, as well as the National KICS Coordinator, Professor Jayantalal Ratnasekara. While excusing for not attending this grace occasion today, both of them are extending their best wishes for this endeavor and hope to collaborate with you all in the future. So let me briefly explain the partnership experience of the Ministry of Education Sri Lanka with the Global Partnership for Education and the GPE KICS. So due to the socio-economic downturn which Sri Lanka faced back in 2020-22, and the general education being one of the most affected sectors in the country, the Ministry of Education decided to obtain grant support from the Global Partnership for Education. As a result of the negotiations had with the GPE Secretariat, the Ministry of Education was able to obtain the membership of Global Partnership for Education, GPE, in January 2023. So from beginning to now, Dr. Hoa Trang Ringrose closely collaborates with the Ministry of Education as the country team lead for Sri Lanka. To operationalize GPE activities in the country, the Ministry of Education has formed local education group with the representation of government institutions, development partners, and civil society as directed by the GPE Charter. After becoming a member of the GPE, Sri Lanka then got the opportunity to become a member of the GPE Knowledge, Innovation and Exchange, GPE KICS, Europe, Middle East, North Africa, Asia and Pacific, simply known as EMAP Hub. The KICS EMAP Hub facilitates cross-country knowledge and innovation exchange and mobilization, learning, synthesis, and collaboration among national education authorities in 35 GPE partner countries in the EMAP region. So as you have already known, currently Professor Rasha Sharaf is the knowledge lead for the GPE KICS EMAP Hub. The national representatives are central to the hub's operation. To participate in national KICS activities offered through the KICS EMAP Hub with the guidance of the local education group, we have appointed a National Steering Committee with 6 members, and the National Steering Committee oversees KICS activities, advises National Coordinator, and reports back to the local education group on KICS activities, progress, and recommendations. Through promoting GPE KICS activities in Sri Lanka, it is expected to acquire new knowledge and skills in policy-relevant topics, create and strengthen relationships both within and across countries, identify educational policies and practices that could be implemented in the local context, and motivate stakeholders for designing and implementing new policies and practices learned from the EMAP Hub activities. Since Sri Lanka became a member of the GPE KICS Hub, attempts have been made to promote GPE KICS activities among stakeholders. As a result, recently, Professor Manjula Vidanapathirana, the Chair Professor of Educational Psychology at the Faculty of Education, University of Colombo, joined KICS EMAP podcast session, and one of the academic staff also got the opportunity to be involved in an education-related research study, which was supported by the GPE KICS research grant. So finally, generating, maintaining, and disseminating credible evidence related to the general education sector is a key thematic area which has been identified in the strategic plans and also identified as a key enabling factor for successful implementation of the policy priorities by the local education group. The National Steering Committee, as well as the GPE KICS EMAP Hub, will find this endeavor timely and very important. Therefore, I wish this seminar and academy to be a successful one. Thank you.
Thank you, dear Madam. To introduce participants, may I invite Ms. Sofia, EMIS Project Manager, University of Oslo, Norway.
Good morning, everyone, and thank you. We've really kicked off to such a beautiful start. We want to say thank you so much to the Ministry of Education, also to the country of Sri Lanka for sharing the rich and diverse cultural aspects with us. We have felt so welcomed since arriving 2 days ago. So my name is Sophia, as mentioned, and I'm with the University of Oslo, but I come together with my other colleagues from the university, as well as the HISP network. So really, we thank you so much for inviting us here, and we're very proud to host this event together with the Ministry of Education and HISP Sri Lanka. So I'd like to take a moment just to welcome, we have so many individuals that have joined us from across Sri Lanka and teams. So I really wanted to take this moment to say thank you to the officials from the Ministry of Education for being here. Perhaps all the Ministry of Education officials could stand for us so that we can see who you are and welcome you today. So everyone from the Ministry of Education officials, thank you. And we can give them a round of applause. Thank you so much. And then we also have officials from the provincial departments of education. If you could stand for us as well. We have 9 provincial departments and all of you are here, so thank you. And then may I also take the opportunity to say thank you to the zonal education officers. If you are here, please feel to stand. Thank you so much. And as well, we have the divisional education officers. If you wouldn't mind standing from us so we can also welcome you. Thank you and welcome. And then, absolutely not least, the school principals. I hear that we have school principals here with us today. If you are here, please do stand. Thank you so much for taking your time to be with us. Then I'd like to also take this opportunity to welcome the Ministry of Basic and Secondary Education from the Gambia. Thank you for flying all the way. Please feel free to stand for us so we can welcome. I'd also like to invite the Ministry of Education and Training from the Kingdom of Eswatini. Please feel free to stand. Thank you, welcome. And then to partners, we have Save the Children, we have UNICEF, we have many other partners in the room. If we have any of our partners here that have joined, please feel free to stand so we can welcome you. UNICEF, I see you to the left. Yes, welcome. Thank you. And then to the HISP network, you've come from far and wide. I'd like to just welcome you to stand so we can see who you are. All the teams from the HISP network across the world. Thank you so much. And then I'd also like to welcome the Ministry of Health and the Ministry of Finance that have joined us today. So please feel free to stand as well. Thank you. And then, last but not least, online. Today we are really proud to be streaming this event together with the GPE Kicks EMAP Hub. So we'd also like to welcome everyone online. We hope that you will enjoy today and tomorrow with us, and we will make sure to ensure that your questions are taken into account and that you feel part and welcome of the family here during these 2 days. So thank you so much for that representation as well. We have 100 people registered, so let us see how the day rolls from today and tomorrow. So if there's anyone I've left out, please, it was not badly meant. We welcome you all and are excited to kick off this event. Then I think the final thing that we'd like to do before we get into any presentations, etc., is also just to let you know that the agenda, you will find it in this docket that has been printed, this beautiful docket. So you will see that the 2 days are really filled with lots of interventions from countries and ministries of education themselves, as well as from partners. We have demonstrations that will be very practical, and we will also have some panel discussions where we can make sure to get some insight from you as the audience, as well as from some experts. So please feel free to have a look through your agenda and see for day 1, we will be focusing a lot more on aggregate information and use, and for day 2, we will shift into the complexity. So I would also like to take this moment to say, we are extremely privileged to have the Honorable State Minister of Education, Dr. Sirin Raghavan. Thank you so much for being here with us today. We're very privileged to have you here, and we hope that you will enjoy this time here with us. Thank you so much. And then, very, very finally, some logistics. There is a WhatsApp group that you can join. If there are any questions that you need at all, logistics-wise, you will find on your table a QR code. Feel free to scan that QR code and join the community in the WhatsApp group, and there you can ask any questions you have at all. Our tea breaks will be taking place right outside this door to your right. my left there. We also have some bathrooms on this side as well as exits. And finally, I think the last thing to tell you is that there will be an expert lounge at the end of each day. This is a great opportunity for you to sit together with another expert from the HISP community, and that will be at the back. You'll be able to see some demonstrations in more detail and get to ask some one-on-one questions if you have any further queries. So I think that is it from me. I can pass it back over to you. Thank you so much.
Thank you, dear Madam.